Okay, we're on to the next one. Now we're going to do respiratory. I'm going to try to do this by myself to see if I know. Okay, so clear the room. I'm here. Hi, my name is Haley. I'm a student nurse at Denver College of Nursing. I'm here to do your respiratory assessment. Is now a good time? Yes? Awesome. Close curtain, wash my hands, check wristband, first and last name and date of birth are correct. So we're going to get started. So first I'm going to ask you some questions. Are you having any shortness of breath? Okay. Any this one's hard. Any shortness of breath? Any trouble breathing? I don't know what I ask. Oh, do you have a cough? Do you have any history of allergies or asthma? And do you smoke or have a history of smoking? That makes sense. Okay, no? Awesome. Alright, so we're going to get started. So I'm going to first, so this is respiratory, so I'm looking. So first I'm going to do a general survey, so I'm just going to ask the patient probably to stand up for me or either sit. So I'm going to be looking at the, just the thorax. AP to transverse is 1 to 2. Chest is symmetric. I don't see any barrel chesting. I don't see any use of accessory muscles. Yeah. Snappy and posture is relaxed. I don't see her in tripod position or anything like that. Okay. So then I'm going to inspect the thorax. So I'm going to ask her to lower her down. Pretty sure. Oh, facial expressions. Ooh. Facial expressions are relaxed. Respirations are even, regular, and unlabored. Okay, so then I'm going to ask her to look up for me, and I'm going to look at the thorax, or look at the thyroid. So looking at the thyroid is in the midline. It doesn't look like there's any deviation. Then I'm going to ask her to swallow. Okay, so it rise and followed well. It didn't. No deviations. Okay, then I'm going to palpate. I'm going to ask her if she has any tenderness with that. She says no. I didn't feel any masses, I had the word, no, I don't see any goiters or anything like that. No deformities. And yeah, I said that. Okay, so now looking at the chest. So I did that already. So that's good. Oh, costal angle, which is here, is less than 90 degrees. Okay. So then I'm going to inspect. Now I'm going to palpate. So now I'm going to palpate the thorax. So I'm just going to go supra. I think that's right. I didn't feel any tenderness or masses. I'm going to do tactile fremitus. So go like this, ask the patient to say 99 every time I move my hands. 99. This is hard to do with the sticks on my head. 99, 99, and 99. Alright, so I didn't, it was equal on both sides and it decreased as I moved down the lung fields. So that was palpation. Now I'm going to percuss. So okay, so upon percussion, I heard resonance bilaterally throughout. Okay, then I'm going to auscultate. So for auscultation, I'm going to be using my diaphragm. So I'm going to do supra. Here, I'll just do it like this. How I did it before. Supraclavicular, supraclavicular, subclavicular, subclavicular. Above the breast, below the breast, below the breast. I heard vascular sounds throughout. I didn't hear any crackles or wheezes. I think that's good. And they're clear and go bilaterally. Okay, so now doing the posterior chest, which is going to be hard because I can't do it on myself. First you're going to inspect, so I don't really know what I would say for seeing. Oh, chest, well, the posterior thorax is symmetric and shape is normal on both sides. AP to transverse is 1 to 2. Yeah, I don't know what you would say. Then I'm going to palpate around, so palpate here, palpate, ask if they feel any tenderness, so no tenderness upon palpation. Then I'm going to percuss, should hear resonance throughout. Then I'm going to auscultate like a sports bra line. I heard vascular sounds. I didn't hear any crackles or wheezes throughout the lung fields. What else is that all? That might be it. I'm just going to read this and make sure I got everything. Okay, we got everything. So when I'm auscultating, every time I move my stethoscope, I'm asking my patient to take a deep breath. All right, take a deep breath for me. Like that. Through their mouth, not their nose, because the nose makes it louder. Okay.